I want to talk about the future because there are three big things that have the possibility of changing the life of people that are getting Parkinson's. So let's go ahead and give that information out. Where is treatment going?
Treatment is going to longer and longer acting dopamines, so we won't have that pulsatility, and we think that will change those long-term complications. It is going to, we have surgeries besides the medications now. We have the deep brain stimulator. And
so
that's
what's a deep brain stimulator?
It's almost like a pacemaker for your brain. Think about the cardiac pacemaker. It's put into the brain, in one on each side, into those areas, the basal ganglia, the motor part, and it's put in there, and then we stimulate it, and it stops their dyskinesias. So when they get those things, like you see with the extra movements, I remember I said it might limit us with treating them. When it does, every time we go up on their dopamine, their dyskinesias get worse. So all of a sudden, we are at an impasse on treating them. They can get the deep brain stimulator. It takes down some of their symptoms of slowness, a little bit of tremor, a little bit of the rigidity, but it doesn't cure the disease. So they are still on their medications, but they may be cut in half. But it takes away their dyskinesias. So now we can use dopamine for the next years of their life, many, many years of their life. So that is why they go to get that right now.
Heredity and stem cells. Tell me about where we're going with those.
Well,
we've only got a couple of minutes.
Big interest is genetics in Parkinson's. We knew only 5% or so were genetic. Most of them are idiopathic, we call it, where it's not genetic. Now, every year we found 2 or 3 more genes, so they're predisposing genes, and we're up to 21 genes or more for Parkinson's. So that is bringing it up to 25% genetic. And then, so they're looking at that, and they're already trying to turn off the genes that one of them was more common, and they're looking at that one and what it produces, and if they can turn that off, then that may lead to genetic testing when people have symptoms and being able to have a drug directed exactly at what you have. And then there are I told you about the screening. We're going to be trying to catch them earlier. So we'll have drugs to slow the disease process down and catch them earlier with the screens, so they won't be down to 30% of their dopamine. And then, so it could delay the onset of their motor symptoms. Then in the treatment phase, which people who have Parkinson's right now are in, the drugs are getting better and better, so that they are living longer right now, but not going to stage 5 Parkinson's, which we used to see. And it's no longer a fatal disease. So they are functioning better, maintaining their mobility, being able to get around and do things better. And then stem cell is going to be, they're looking at stem cell now. So you will be hearing about trials that'll be starting with stem cell, and it is restoring the therapy by putting cells that can become dopamine producing cells into the brain.
Boy, huge advancements that are coming. You mentioned earlier that for the next several years, once a year, there's going to be a new medicine that's going to come out. It's going to be a good chance of coming out that will improve the lives of people with Parkinson's. I think it's absolutely amazing to me.
Yes, we had 2 in the last year that came out. One of them was the pump. There is now a Duopa pump that gives continuous dopamine 16 hours a day through the abdomen. So you have to get a J tube. But that continuous dopamine has helped people who can't get the deep brain stimulator or have a lot of trouble late in the disease. So it's smoothing them out, and they're doing much better. And they're able to give themselves extra doses at home when they need it. And then the other one was the longer acting dopamine came out, and it went from 2 hours to 5 hours.
So huge advances, huge amounts of things that we can do to prolong the life, to start early where the life is more functional. Michelle, really the information is overpowering. It is absolutely fantastic. Thank you for coming to the Dr. Bob Show and telling us that the future for early diagnosis in Parkinson's will lead to a life that's, I won't say completely normal, but I will say nigh unto normal.
Better. And we tell the patients it's a time of hope. We're seeing so many things in Parkinson's, and great discoveries are being made.